Good afternoon. We'll now start. Before anything else, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include your names, the names of your companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. Then there'll be group pictures at the start and end of the pep talk. As a reminder, please take the online Learning Kung Evaluation Test exercise for Mastery of Learning and have a perfect score to get a certificate like the one shown below. The link has been placed in the chat box as well as in the Viber group as well as in the Facebook group. Another reminder, 50 OLETE certificates will entitle one participant to a voucher for a ROJoson telemedical consultation. Another request, those who are not planning to take the OLETE, but I encourage you to take it. In the OLETE, I ask for feedback to my pep talk. If you're not going to take the OLETE, please type in your feedback in the chat box during the open forum. Let's now have a group picture taking before we start the pep talk in a few minutes. Okay, ready? Ready? 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk for the information who came late into the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on the enthusiasm of the participants. My pep talk today is entitled Gastroenteritis, Fundamentals and Generalities in the Management. This will be part of the health disorder as well as health issue course. The empowerment objective is for the lay people to have an understanding of the fundamentals and generalities in gastroenteritis in their health management. Some definition of terms in the title. When I say fundamentals, when I use the word fundamentals, it means just the basic principles, the foundation and the basis of something. Generalities, majority, not all, not detailed, not specific. And then management, meaning medical management, usually done by physicians or which I will recommend. The contents of this particular pep talk will be the following. What is gastroenteritis, or gastro for short? How to differentiate gastro from food poisoning, indigestion, and food intolerance. What are the preventive measures of gastro? What causes gastroenteritis? What are the symptoms and signs of gastro? How to diagnose gastro? What are the usual diagnostic tests? How are gastroenteritis being treated? And then what are my advocating statements and advice on gastroenteritis? Almost any person, young and old, will experience or have experienced sudden abdominal pain, or distress or discomfort, nausea with or without vomiting, and diarrhea, either alone or singly or in combination of some of all of the above symptoms. I suppose all of you present in the audience now have experienced this. I'm sure of that because I have also experienced this. But what is the question is, what is the diagnosis when you experience all the above symptoms? Is it food poisoning? Is it indigestion? Is it food intolerance? Is it gastroenteritis or others? Gastroenteritis or gastro is defined as the inflammation. That's why there's the suffix there, itis, gastroenteritis or itis. Itis means inflammation of the stomach. Gastro means stomach, and intestine, the entero means intestine. The inflammation may be associated with infection, or it may remain only as inflammation without infection. So in reality, in the life of a patient, of a person, you may have only inflammation but no infection. But when you have infection, it starts with inflammation. Okay. So not all inflammation will end up with infection. So enteron, the word enteritis derives from enteron, strictly speaking, refers to just the small intestine. Enteritis, small intestine. Loosely speaking, it can include the large intestine, as used in this phrase, gastroenteritis. But the Latin word for large intestine is usually colon. Enteron means small intestine. For the large intestine is colon. Okay. So since most of the time, the diarrhea, the stomach pain, the nausea, and vomiting usually involve the small and large intestines. Usually, a better term there is gastroenterocolitis, but this is not commonly used. What is commonly used is just gastroenteritis. So as I said, this could be a better term, gastroenterocolitis, involving the stomach, small intestine, and large intestine. A question is, how do you differentiate food poisoning, indigestion, food intolerance, and gastroenteritis? The World Health Organization defines food poisoning as foodborne illnesses, usually infectious or non-infectious or toxic in nature, caused by bacteria, infectious, viruses, infectious, parasites, infectious, or chemical substances entering the body through contaminated food. Okay. So contamination in the food. The presence of contamination in the food, in the gut, in the small and large intestine, in the stomach, will lead to symptoms of abdominal pain, nausea, vomiting, and diarrhea. By the way, nausea means napapasuka. No? Vomiting is real vomiting, suka. Gastroenteritis is an inflammation and infection of the lining of the stomach and small and large intestine. Although most cases are infectious in causes, drugs and chemical toxins can also cause gastroenteritis. So hindi lang from infectious diseases. Gastroenteritis is a more general term, and food poisoning can fall under it. Other entities as well, okay, so that can cause inflammation of the stomach, small and large intestine, can be considered as gastroenteritis or gastroenterocolitis. How about indigestion? Indigestion is conventionally defined as pain in the stomach ito, after eating food that is difficult to digest. The other medical term for indigestion is dyspepsia. Symptoms usually consist of upper abdominal discomfort, And sometimes you can have nausea and vomiting. Diarrhea is not frequently seen, is not consistently present in food indigestion, but it can be present at times. How about food intolerance? It occurs when the digestive system cannot tolerate certain foods. Unlike food allergies, which can cause hives or respiratory problems, an intolerance to the food only affect the digestion. So food intolerance can also produce the nonspecific symptoms of dyspepsia. Food intolerance may be difficult to differentiate from indigestion. So a tip on how to differentiate the two: repeated similar symptoms with repeated similar food intake. If you're eating the same food and then you have the similar symptoms, then you can think of food intolerance. Okay, food intolerance rather than indigestion. Indigestion probably yung one time lang or twice, okay, but repeated 3 times, 4 times, no, you have symptoms of eating certain foods, similar foods, and then you have some symptoms of abdominal pain, nausea, and vomiting. Then you think of food intolerance. If one cannot be certain on the specific type occurring in a patient with abdominal pain, nausea, vomiting, and diarrhea, one can safely say a patient has gastroenteritis, as this term is a general term and is encompassing. But remember the baseline definition of gastroenteritis, which is inflammation, which may sometimes it can lead to infection, but basically it's inflammation first of the stomach, intestine, small intestine, large intestine, causing the symptoms of abdominal pain, nausea, vomiting, and diarrhea. Now, as one observes the course of the disease, one may get clue on the specific type, but this can be done in retrospect or afterwards. Okay. So you have to observe the course of the disease, okay, whether the symptoms are due to food intolerance, food indigestion, food poisoning, etc. Personally, I've been very cautious in eating foods which may cause gastroenteritis, food poisoning, indigestion, and food intolerance. I've been advising also my patients on this because I see a lot of patients suffering. And then I told them that you just have to wait. Sorry, no, okay. So next time, don't eat. Be very cautious in eating, in putting foods into your mouth. So why I am very cautious and why I have been advising patients, because the suffering is so great, particularly when one has severe abdominal cramps, diarrhea, and vomiting, and one has to wait for a long time, usually days, 2 days, 3 days, for the healing to take place, particularly those with food poisoning and other severe forms of gastroenteritis. So this is even with medication. Sometimes you just have to wait. Some tips in preventing gastroenteritis: beware of and be vigilant in eating foods that may cause gastroenteritis, food poisoning, indigestion, and food intolerance. Avoid or do not eat or even to taste food which are potentially spoiled. So be on the lookout. Baka spoiled ang food. So you can get some clue whether the food is spoiled visually by looking or through taste and smell. If there is some suspicion that it's spoiled, do not eat it anymore. Throw it away. Know your body and how it reacts to different foods and drinks, because this will help you avoid the food intolerance or food allergy or food indigestion. Spicy and acidic foods and carbonated drinks can trigger indigestion. So try to avoid those things when possible. If you have to eat it in moderation. Eat smaller meals throughout the day, and don't eat too late at night. Don't lie down too soon after eating. So it's better to walk for a while before you lie down. What causes gastroenteritis? Gastroenteritis may be caused by the following: viruses, and these are by far the most common cause, and which include the so-called rotavirus and norovirus infections. Aside from the viruses, the other causes will be bacteria, such as Salmonella and Shigella, and then toxins produced by the bacteria, and then parasites, example will be the Giardia and the amoebiasis, and then chemicals such as toxins from poisonous mushrooms. So basically, the symptoms and signs of gastroenteritis are the following: abdominal pain or discomfort, nausea with or without vomiting, and then diarrhea. And then to say that you have gastroenteritis, okay, there must be an accompanying findings of there are no signs of acute surgical abdomen. When you say acute surgical abdomen, you have a very severe tender abdomen which may need an operation, such as acute appendicitis, perforated peptic ulcer, etc. Okay. So these conditions, surgical conditions, can also present with abdominal discomfort and pain, nausea, vomiting, and diarrhea. So to say that one has gastroenteritis only, make sure there is no signs of acute surgical abdomen, okay, which is usually prompted by the presence of very, very severe abdominal pain, and which should be evaluated by a physician. Okay. So depending on the time of onset, the severity of the inflammation, and the extent of the involvement of the gut, okay, the symptoms that I mentioned, abdominal pain, discomfort, nausea, vomiting, diarrhea, may appear singly. Sometimes you just have abdominal pain only. Sometimes you have three. Sometimes you have abdominal pain and nausea and vomiting, no diarrhea. Okay. So the symptoms may be appearing only in singly, one only, or twice, or combination of two, or even three. Okay, and maybe all. Okay, and maybe mild, moderate, and severe, depending on the situation. So how to diagnose gastroenteritis again? At times, the diagnosis of the type of gastroenteritis present can be aided by the following. Okay, is it acute or chronic? Whether the patient can recall an antecedent event, okay, taking foods or drinks, okay, let's say an hour or 1 day before, okay, which may be the cause of the trigger. So you can suspect that that's the cause of the gastroenteritis. Whether the diarrhea or dysentery is present. When you say diarrhea, it's not dysentery. When you say dysentery, it's a very severe diarrhea with mucus or blood in the feces. Diarrhea, just watery stool. And the other clue that you can make use of, whether the course of the symptoms are short-lived or not. If it's long-lived, it can mean something. So when you say short-lived and mild gastroenteritis, short-lived mild gastroenteritis, these are usually due to viral and bacterial infection. If it's a long-lived or longer duration and more severe gastro, it is usually due to food poisoning and dysentery. And then when you talk about dysentery, you're now talking about possible salmonella or typhoid, shigellosis, and amoebiasis. These are the more severe type of diarrhea and the more severe type of gastroenteritis. For those with diarrhea, usually the stool exam, so we're now talking about diagnostic tests, usually stool exam for those with dysentery and chronic diarrhea is being done. Otherwise, there's no need for stool exam, especially those with just diarrhea. Okay? Not dysentery, just watery stool, no blood, no mucus. Okay. Now, for those without diarrhea, but with just persistent abdominal pain, which can happen, okay, so with or without nausea and vomiting, and with chronic dyspepsia, let's say it's a long, it's not short-lived, it's long-lived, it's occurring for recurrent and for a long time, then the options will be to do upper endoscopy or upper GI series to check the stomach and intestines, and or CT scan. Otherwise, if the symptoms are not persistent, there's no need for further diagnostic tests, just monitor. Okay. Of course, there are other sophisticated tests that may be done as indicated after the basic ones are done and if more information are needed, aside from the endoscopy, upper GI series, and CT scan. How are gastroenteritis being treated? In this section, I will now include my advices on advocating statements and advice on gastro. So for those with dysentery, yung severe diarrhea, especially with blood, okay, antibiotics and antiprotozoal are usually given from the supportive, aside from the supportive management, particularly of hydration. The antimicrobials that are being used are the following: cholera. Okay, so usually you have chloramphenicol and other antibiotics. Okay, so you can give antimicrobials for if you're suspecting cholera. Now, if you're suspecting shigellosis, there's another type of antibiotics that can be used. And then if you are suspecting amoebiasis, there's another group of antibiotics that you use. Usually, the so-called metronidazole is the commonly used for amoebiasis. So drugs may be given, aside from the antibiotics, the drugs may also be given to alleviate the abdominal pain, nausea and vomiting, and diarrhea. Now, for those with non-dysentery, just watery stool, no antimicrobials are needed. Just supportive management, particularly of hydration. But drugs may be given as indicated for associated abdominal pain, nausea, vomiting, and diarrhea. For those without diarrhea, let's say a patient has just abdominal pain and nausea and vomiting, so you don't need anti-diarrheal drugs. So, but you can give drugs for the associated abdominal pain and nausea and vomiting, especially if they are severe. For mild one, you can either just observe, okay, or just put some supportive management, use supportive management. Now, for those without diarrhea and nausea and vomiting, just abdominal pain lang. So no drugs against nausea and vomiting and diarrhea are given. Okay. Just observe and monitor for the appearance of nausea and vomiting and diarrhea. You observe lang muna. Now, if it's the pain is so severe, then you can give drugs already. If it's mild, you just observe, just put warm compress probably on the abdomen and do some supportive management. Now, for those without diarrhea and abdominal pain, just nausea and vomiting, you have instances like this, nauseated lang pasyente, yung tao at nagpabamit but without diarrhea and abdominal pain. Again, no drugs are given against diarrhea and abdominal pain because these are not present. Just observe and monitor for the appearance of the abdominal pain and diarrhea. Kasi over time, baka lumabas yung abdominal pain and diarrhea. If it does not appear, well and good. Mas maganda, okay? So when you have severe nausea and vomiting, then you may have to give some drugs already, aside from the supportive management. So my approach in the management of gastro, okay, I will not include the dysentery here. Okay. So once you feel any or combination of the symptoms that may indicate the start of a gastroenteritis. So symptoms are the abdominal pain, nausea, and vomiting. Number one, let your abdominal stomach settle, meaning just wait, do not eat solid foods for a few hours. Observe closely the course of the symptoms. Kung may abdominal pain, baka maging severe, or baka mamaya lumabas na yung nausea, vomiting, o mamaya lumabas na yung diarrhea. So just observe closely the course of the symptoms. And then hope and pray that they disappear soon. Start thinking back what you ate or drank hours or at least 1 day before, and then try to hypothesize the cause. A lot of times you don't know the specific cause, but try your best to hypothesize it so that you can learn something from it. So next time, if you think that's the possible cause and the symptoms disappear, you may want to avoid committing the same mistake. If symptoms are mild and tolerable, there's no need to take any medications, but continue to observe with the hope that they will disappear soon. But you have to ensure adequate hydration with water intake, particularly if there is diarrhea. If the symptoms are moderate and to severe and not tolerable, masakit na masakit, then for the abdominal pain, you can try warm compress and then antispasmodic drugs. Usually, yung mga masakit yan, yung mga spasm. And then for nausea and vomiting, you can try ice chips and then give your anti-nausea and vomiting drugs. And then for the diarrhea, if it's so severe, they can give anti-diarrheal drugs. So remember to take medications only when needed. When you say not when needed, it's intolerable. If it's tolerable, wag na muna, because you want to have time to observe the course of the disease. So there are benefits of watchful waiting because it can help evaluate the diagnosis in terms of the cause of the gastroenteritis, and also it can help you determine the course of the disease, whether it's improving or not. Okay. And then just think when you take medications, there are always side effects in the use of these medicines. Why not to take anti-diarrheal drugs when not strongly needed? We know that a lot of people konting LBM lang, they take a lot of anti-diarrheal drugs already. So the reasons for this will be the drugs that can cause the diarrhea to stop or decrease. It's true that the drugs are very effective in stopping the diarrhea. However, they are not treating the cause of the diarrhea. Okay. So if you give the anti-diarrheal drugs now to stop the diarrhea, you're actually stopping the diarrhea only, but not the cause. So if you stop the diarrhea, you won't be able to know you won't be able to observe the course of the disease. Second, they don't facilitate toxin to go out through the anus because it stops the flow of the toxin down to your anus. Okay. And then lastly, the third reason is that there are potential side effects of the anti-diarrheal drugs. There are usually many options in the selections of drugs for each purpose, which I will not include here as a list. Okay. We just remember that the physician has to use the BRCA in the selection of the most cost-effective one, benefit, risk, cost, availability. Okay. So remember, generic drugs are as effective as innovator drugs because there are a lot of same chemical names with different brands, and then some are more popular, some are more well advertised, but they are more expensive. Okay, so the generic drugs might be is as effective as the so-called innovator drugs. Again, what are the preventive measures? Let me just repeat again. I've been very cautious in eating foods that may cause diarrhea, gastroenteritis, food poisoning, indigestion, and food intolerance. And I've been advising my patients on this. The suffering is great, particularly when one has severe abdominal pain, diarrhea, and vomiting, and one has to wait for a long time for the healing to take place, particularly those for food poisoning and other severe forms of gastroenteritis. Tips: beware of and be vigilant in eating foods that may cause gastroenteritis, food poisoning, indigestion, and food intolerance. Avoid and do not eat, even to taste, foods which might be potentially spoiled. Know your body and how it reacts to different foods and drinks based on experiences. And then spicy, acidic, carbonated drinks can trigger indigestions. So try to avoid these foods as when possible, or eat in moderation. Eat smaller meals throughout the day and don't eat too late at night. Don't lie down too soon after eating. So summary and takeaway, I've discussed the following topics. What is gastro? How to differentiate gastro from food poisoning and digestion intolerance, preventive measures, causes, symptoms, how to diagnose, what are the usual diagnostic tests, stool exam, how are gastro being treated, no meds, with meds, what are my advocating statements and advice on gastro. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on gastroenteritis to put yourself in good shape always. Knowledge is power. It gives power. Use the 4Ks of patient empowerment, kaalaman, kakayanan, karapatan, kapangyarihan to gain greater control over decisions in medical management of oneself and also your relatives by knowing the fundamentals and generalities of gastroenteritis in the health management. So with that, I end my pep talk. I hope I have empowered you to have a better understanding of the fundamentals and generalities of gastroenteritis in your health management. I just limit myself to fundamentals and generalities because there are a lot of things to discuss here, but I cannot cover everything in so short a period of time. And then as a reminder, please take the online learning kung evaluation test exercise. And then reminder, if you have gotten 50 or latest certificates, you're entitled to 1 voucher for free ROJoson telemedical consultation. And then please type in your feedback in the chat box during the open forum. And then let's now have a group picture taking before we start the QA and interactions. Okay. That's it. Show your face, beautiful faces. Okay. Last call to show your faces. One. Okay. Oh, let's wait for. Okay, Melly and Chris. Okay, nobody. Okay, let's 1, 2, 3. Okay. Okay, so the floor is now open for questions, reactions, comments, sharing of experiences.
Doc, I would like to share.
Others.
I'd like,
okay, whatever.
Doc.
Susan, you're trying to
Yes,
say
Doc.
something, but we
Yes.
cannot hear you.
I already unmuted.
No sound.
No sound. Oh, wait. Something must be wrong with my
Okay.
cell phone.
Okay, can you repeat? Sorry,
I can hear. I can hear her.
Something must be wrong with my cell phone.
No, we can hear you now. We can hear you.
Okay, Doc. First, of course, I've experienced stomach pain a lot of times, but I'm always some friends to take hot tea, apple, or biscuit. Is that correct?
Yeah. When you have stomach pain, okay. So you have to know what's the cause, right? When you have stomach pain, you have to know the cause. Okay. So you end up with because if it's just stomach pain, because okay, probably first few minutes you feel the stomach pain now. So you still don't know the details now, how it will run now, but you feel something already, you're bothered already now. Okay. So, but you try to hypothesize, is it what is the diagnosis? Now, what's causing that? Now, okay. So, is it non-specific? Baka may nakain ka lang, no? Okay, no, you drank something, no? Or is it the start of something more serious, no? Okay. Because appendicitis, peptic ulcer can also have stomach pain, no? Okay. So what you do is just observe for a while. Observe for a while, no? Okay. So you would observe for a while to see the course of the abdominal pain. Is it progressing? No? Is it associated with other symptoms later on? No? You just observe for a while. But while you are observing, i-rest mo na yung stomach mo. Okay? Rest your stomach. Don't eat a lot of things. If you have to eat something, or if you have to put in something to your mouth, probably water, or as you mentioned, tea. Okay? Pwede. No? Yung mga ganon. No? Okay, blood fluid, pwede, no? Or if you have to take in some food, blunt diet muna. Okay? Then continue to observe. Okay? Okay? Hanggang mawala. Kung di siya mawala, then baka may lumabas pa ibang symptoms that can give you some clue. Okay?
I see. Okay, thank you.
Okay. So remember, kahit na yung meron kang abdominal pain, it's not always gastro, ha? Baka it's a start of something serious, pwede rin. Ha? So if you have abdominal aneurysm, which is not common, you can also have abdominal pain. If you have acute appendicitis, you have abdominal pain initially, di ba? You have cholecystitis, no, gallbladder diseases, you can have abdominal pain. Maraming causes dyan, na? So it's very important that you observe closely. No, jot down, put some notes, paano ba ito? Ano yung takbo nito? Masakit, no? At usually may associated symptoms o wala, no? You observe mo muna, no? Okay.
Doc, which part of the stomach, right? Is it usually the right? It is appendicitis.
Appendicitis, yung pinaka last area that will be very tender is the right lower quadrant. Right lower sa baba. No? But initially, in the early stage of acute appendicitis, you can have pain dun sa sikmura mo, dun sa epigastrium. No? So after a few hours, it might go down to the right lower. No? So yan ang isang possible cause of acute appendicitis. Pero in some patients, hindi nangyayari yung course na yan. Basta diretso na lang sa right lower quadrant. Iba-iba. Iba-iba. But the reliable basis for suspecting acute appendicitis is that for us surgeons, when you have a tenderness means pinipindot na masakit sa right lower quadrant. Okay? Sa right lower. No? Alam mo yung right lower, no? The stomach, you divide it into 4 quadrants, then sa right side, sa baba, kung masakit na masakit at persistent, progressive, then we start suspecting acute appendicitis. No? Okay. Of course, if you're females, we have to make sure that it's not due to the ovarian or due to menstruation, etc., etc. No? Okay. Any more?
There is a question from Jocelyn P. How many times LBM in a day can we start taking Ursiflora? Once started taking Ursiflora, should one stop taking it?
Okay. Okay. Can you enlighten me on Ursiflora? I'm sorry, I'm not familiar with that drug.
Anti-LBM.
Anti-LBM.
Yes.
Yes,
So
Am I correct, Ma'am Josie?
yes. Anti-diarrheal.
is it what is the chemical name?
Sorry po, Doc, wala na akong extra on
I
hand.
think it's herbal, Doctor.
No, it's not herbal.
Okay.
It's not
Na?
herbal. Parang ano siya, kapatid ng Ursif. For real?
Imodium?
Noon yung ersiforil, is it an antibiotic?
Okay, I'm sorry, I'm not familiar with that, huh? Okay, but
Okay, it's okay.
if you say it's anti-diarrhea,
Yes.
Oo.
so
Yeah.
okay, so let's go by the principles, huh? So how many times of LBM in the day can you start taking Versiflora?
Yes.
Once started, should one stop taking it as soon as there is no more LBM? So in my lecture kanina, I said, so you assess the severity of your LBM. Now, okay, if it's when you say, let's say you can have 4 times, 5 times of diarrhea in a day, pero konti-konti lang lumalabas, it's still mild. No? Okay. So you don't, it will not cause dehydration. No? Okay, kung konti-konti lang. So you just keep on taking fluid water. No? Okay. So that's not really the number of times, but the amount of
The amount.
okay, the amount. No? Now, if it's talagang marami na lumalabas, no? At usually it cannot be controlled by just
taking water.
no diet, no eating, just water, no? Okay, give it 1 day to observe muna. Okay, don't just jump into taking it, no? Okay.
Okay.
Then if it's after 1 day, kung talagang marami na, then you can take anti-diarrheal drugs, no? Okay. Anti-diarrhea drugs. Then once you have once the diarrhea stop already, no, then you stop your anti-diarrhea drugs already.
Okay. Thank you,
Okay.
Doc.
So
Yes.
as needed lang, hindi isang kibot, no? You take the anti-diarrhea drugs, whatever it is, no? Okay.
Okay. Thank you, Doc.
Ako, to tell you honestly, as far as I can recall, of course, I'm a human being also, just like you. I have bouts of diarrhea. I've never taken anti-diarrhea drugs before. I just rely on fluid and then just wait.
Okay.
Ang ginagawa ko lang, probably yung masakit na hindi ko na makaya. But not anti-diarrhea because I believe that I have to let the toxins go out. Let it go out. Rather than when you take anti-diarrhea drugs, it stops the intestine from putting out the toxin. Now it will accumulate there. No? Okay. So that's the principle behind it. No? Okay. Now, but kung minsan naman yung ibang sinasabi nila, okay, yung mga executives, they're going to travel, di ba? Yung mga ganon. So they take one already para to prevent diarrhea. No? Okay. Okay. Other than that, hindi kailangan. No?
Thank you, Doc.
Even when you are hospitalized, ang binibigay lang naman sa iyo, suero eh. Pwedeng walang anti-diarrhea drugs, just suero lang if you are hospitalized for diarrhea. No? Okay?
Okay, thank you.
Okay. Abet?
Maria Hustapolotan, Versiflora is Bacillus closil. Am I
Closi. Ano yung
correct pronouncing it, yung Maria Husta? Bacillus closil, Versiflora.
Miss Jacqueline Frank, right? It's a probiotic. Hindi siya gamot.
Probiotic. Probiotic.
Okay. Yeah.
Pero nakasulat anti-diarrheal sa box.
Okay. So
Yung follow-up, Ma'am Jacqueline Tong, isn't Versiflora more of a probiotic that is used to help restore the good bacteria in our stomach?
Yep.
Yeah. I guess baka probiotic nga yun. No? Because of the word Versiflora. Okay. Jocelyn, check lang natin, Jocelyn. Ha?
Yes.
Anyway,
But I
okay.
vividly recalled yung nakasulat sa box, it's anti-diarrheal.
Ayan.
Okay. Kasi ito yung mga probiotic, they put a lot of yung mga come on, no? come on advertisement, no? Okay. So,
Yeah, excuse me, Doc, pero usually po, like, most doctors, like my doctor, when I had mebiasis, she prescribed the Ursiflora because yung continuous diarrhea, yung good bacteria sa stomach mo that helps in digestion, kasama ng pagpupuan niyo po. That was what was explained to me. So you have to replenish it with that. It's just a small vial that has no taste.
Yes,
It's
no taste, yes.
Yeah, it is also being prescribed by Dr. Radici, Ursiflora.
pag masama na yung super, like every 10 minutes you have to go.
okay.
Yes. I take it just to be sure nga eh.
Okay. So, but okay, my personal stand, I don't, I'm a minimalist physician because I don't usually take in anything kung di naman talaga kailangan, no? Okay. So, when you have amoebiasis, you take care of the amoeba, di ba? You try to kill the amoeba, but sometimes the antibiotics can also kill the normal flora, no? Okay. So, but once you kill the pinaka cause, yung amoeba, no? Okay. So then you just let the normal flora recover. Okay, kaka-recover naman yan eh, no? Eventually, no? Okay. So I would suppose if can you think of it like me, like this way? So years ago, kung wala pa yung Ursiflora, marami bang namamatay kung hindi mo binigyan ng Ursiflora?
Palagay ko wala.
Di ba?
No.
So, 10 years, 20 years ago, 30 years ago, no? So when we treat amoebiasis, we just give yung metronidazole, we don't give Ursiflora, and 99% will recover, no? Okay? So nowadays there are a lot of things coming out in the market, no, which may not be necessary, no. Okay. Okay. They will say, oh, it will help, it will help, it will help, no. So it's nice to have. Yung tinatawag nice to have, maximalist, ganon, di ba? Okay. Okay. It's also good for the business, di ba? Ganon, no? Pero hindi naman kailangan, no. Okay. It won't kill you kung di mo. If you don't take it, it won't kill you. Okay. That's the bottom line, no. Okay. Any more?
Yeah, from Mel Cabrera, just sharing. Every time I experience abdominal pain, hot compress helps a lot.
Yeah.
Yes.
Yeah, hot compress. But it all depends on the type, no? Pero kung isa, kusang nawawala rin, di ba? Kung mild lang. Okay. So the bottom line there is once you have abdominal pain, unang isipin mo, ano ba yung kinain ko? No, di ba? Kasi marami tayong kinakain eh, di ba? Kung ano-ano, no? Tapos hindi natin makontrol kung minsan sobrang dami, di ba? Okay. Aside from the type of food, but the amount, di ba? Okay. Yeah, the lesser you eat, the better. Okay. Okay. Any more?
Nothing at the chat box.
So how many have experienced severe abdominal pain? Talagang masakit na masakit.
Me. Me.
Oh, anong ginawa sa'yo?
I was run to the hospital.
Then they
Yung
give
pala
you
UTI. Yung pala UTI.
the before. You shared with us already last time.
Yes, yes.
Pero yung iba, yung in the past. Kasi also all of us have experienced severe abdominal pain, yung cramp na talagang crampy, di ba? Aside from
Yes.
diarrhea, no?
Pagka sobrang sakit, I just take Gaviscon.
Gaviscon?
Yes.
Okay. Gaviscon is for the stomach, for the dyspepsia.
For the
Okay.
acid, no?
For the acid, no? But suppose you have diarrhea and then abdominal pain, sakit-sakit.
Sobra.
So you can take antispasmodics. Antispasmodics will be the that will be
Like
the solution there. Now,
ERC,
aside from the
ER
warm compress, take antispasmodics. Kasi
Lord,
masakit.
Doc, this is Susan.
Mm.
Doc,
Yeah, Susan.
I take Buscopan.
Yeah, just take
Is
one.
that safe?
Pwede na. Hindi, lahat naman gawat may possible side effects. No? But if it's talagang kailangan na, you have to take one. You take one. No?
Antispasmodic ba yun?
Yeah,
Okay.
that's one of the antispasmodics. There are a lot of antispasmodics, but that's the most popular now. Okay. Okay. So what's your experience? You took it once or twice?
Only once, Doc.
Nawala.
Okay naman. Oo.
Maswerte ka.
Pero followed by hot tea.
Yeah.
Hot tea. Oh.
Okay. And then, okay. Are you thinking that hot tea will resolve your problem?
Medyo komportable kasi ako sa hot tea, pero pag sobra na ang sakit, I take Buscopan. But there was a time na talagang nai-ER ako. Yung pala, I ate spoiled, ano ba to? Ano bang pagkain yon? I think it's a baked product. I didn't know it was spoiled. Type na type ko pa naman kainin. Ayun, nai-ER ako talaga. Grabe.
So food poisoning yon.
Oo.
Okay.
And they have to extract blood. Ano ko ba kung ano yung mga inano sa akin. Tapos, as you said, hinhydrate ka agad ako using suero. Ayun.
Okay. Precaution. Okay. When do you go to the hospital? That's the issue. When do you go to the hospital?
Pag hindi na kaya, pag ang sakit-sakit na talaga, na talagang I don't know the real cause na.
Yung talagang masakit na masakit, you can go.
Oo.
Okay.
Parang may hilo ka na eh.
Oo. Pero kung kakayanin pa, you can warm compress, and then if you have Buscopan at home, take one, then observe very closely. And then when you have diarrhea, you just take a lot of water. Do not eat muna, no? Okay. So don't be afraid of dying from starvation. Okay. So,
another question, I hope you don't mind. How about this commercial drink that we take? Ano nga ba yun? Gatorade, yung mga ganon.
Hindi kailangan yun sa akin. As I said, just remember 20 years ago, 30 years ago, wala namang Gatorade yun eh. We just drink a lot of water. No. Okay. So
anyway, thank you.
Pero Dok, yung laging inaano nila eh, pagka minsan mismong doktor sinasabi, take Gatorade.
Di ba sabi ko sa iyo that there are three kinds of doctors. One is yung tinatawag na minimalist. One is maximalist. What's the third one? What's the third type?
Minimalist.
Kala ko maximalist yung third eh.
Hindi, three types of doctors. I forgot,
Minimalist.
how do you call that? Yung reflex lang, yung palaging hindi nag-iisip, basta kung ano yung popular, bigay na lang.
The one who follows a
I forgot the
fad.
impulsive, reflexive, ritualistic. Okay, one is
Ritualistic.
ritualistic, one is maximalist, one is minimalist.
Minimalist.
No? Okay, so those who are minimalist will not give you Gatorade. No, okay, but those who are maximalist and ritualistic kasi baka natuto nila sa yung mga older doctor nila, yung habang in training, their doctors, their consultants usually give that, no? Okay, so they just prescribe. Maximalist, baka okay, nice to have, di ba? Nice to have, di ba? And then they want to please the patients, kung gusto ng pasyente, they ride on the ignorance of the patient, no? So yan, no? As I said, think back. No? 20 years ago, 30 years ago, wala. When I was younger, 73 na ako ngayon. Kailan ba yung Gatorade? Kailan ba lumabas yan?
10 years ago.
10 years ago. So,
Di lang, baka 20 years ago na.
Susan, umiinom ko ng Gatorade noon? Hindi, di ba?
Hindi pa. Earlier, hindi.
Di ba? Wala naman nangyari sa'yo, di ba?
Advertisement kasi ngayon.
So you just drink water, and then if you want, you put salt, some salt water, pwede rin, andun, pareho na rin yun. Mga electrolytes lang yun di ba?
Pedialyte.
Oo. Okay.
Doc, I take Hydrate.
Okay. Popular din yun. Pero kung kailangan lang, if you have severe
Diarrhea.
Okay. If you have severe diarrhea, then you can take it. But otherwise, you just drink a lot of water. No? Okay. Okay. Any more?
From Ma'am Jacqueline Tong, some people suggest taking pineapple juice or Coke to help ease diarrhea. Has anyone used it?
Ay, naalala ko pa, kasi yung sarsi pala, sarsi na may itlog.
Okay, number one, okay, you can take pineapple juice or apple juice. Okay.
Pineapple juice. Pineapple juice.
Some people swear by pineapple juice, which I cannot understand.
I'm not, has anyone used that? Ako have not used it.
Never.
I
Never.
also never.
Pero mas magiging grabe yung abdominal pain mo when you drink pineapple juice.
I don't
I
like
think so
pineapple.
too.
Yeah.
I don't know nga. That's why I'm asking.
Maasim kasi sa ano siya eh.
Yes,
Kasi
lalo na
mura.
pag acidic ang tiyan. Oo.
Nakakasikmura po.
Nakakasikmura siya.
Okay. Have you tried it, Jacqueline?
Not me, but a
Some
relative.
people. Yeah.
A relative has, and I cannot understand
Okay.
how it
How about
works.
the Coke? Sugar lang yung Coke diba? Water lang yun.
Mm.
Baka
Siguro
Coke. Parang
best na yung
sugar.
advice mo ng water. Best advice na po yung water siguro, sabi nyo.
For me, I just do water.
Yeah,
But
water
hot
lang.
water.
Water lang to prevent dehydration, because
Mm.
water is coming out. Now, if you want to have some glucose, no, yung mga pagkain na because you cannot eat much, no, then you can put some sugar water, or mga baka apple juice pa pwede, apple juice, di ba? Apple
Yes.
tends to make
Arden.
harden, di ba?
Yes.
Mm-mm.
But I've not heard of pineapple juice and Coke, no.
Latundan.
Oh, you can eat also blunt diet, and then kung kaya,
Banana.
just eat banana, no?
Banana.
No? Ganun.
Tundan.
Okay.
Angelina Tonyola said, me pala, when I took VCO,
Virgin coconut oil. Oh,
Yeah.
sige, anong experience mo? Talagang nakakatulong? Unmute.
Hindi ba lalo mag-LBM?
Ano po, sobrang nag-watery siya, tapos sobrang sakit ng tiyan ko, tapos talagang very painful po. Pero nag-stop din naman siya.
Okay, so do you have to take VCO?
Nag-try lang po kung uminom siya.
Okay, so when you take something, make sure you try to analyze, is it baka yung disease itself pagaling na, tapos uminom ka noon, baka sabihin mo, yun ang effect ng gamot yan, no? Okay, so take note of that, no? Okay, so kung minsan pagaling na, kahit hindi ka uminom, no, ng VCO, hindi na kailangan, diba? Okay, so that's how you analyze all these things that you read in the internet, no? Okay, may mga umiinom ng gamot, pero hindi naman kailangan, because a lot of times you just compare ano ba experience of other people. They don't take anything at all. No, gumagaling, di ba? Okay. Okay.
What about the one that I experienced a month ago? I told you that I have vomiting, abdominal pain, and then LVM. You said it has nothing to do with my gallstone. The other doctor said it has something to do with my gallstone.
Oh, anong problema?
Conflicting.
He wants me to undergo operation. And you said no.
O sumakit pa ba? Wala.
Parang
Nawala.
nawala, pero di ba I was telling you before, yung parang may konting pain, but nawawala naman siya.
No, usually you don't have diarrhea with gallbladder problem. Okay.
Because he keeps on nagging me to do the operation.
Okay. Hala ka na, you make a decision. But me, I gave you advice. No? So my advice is that you have gallstones, then when you have gallstones, you can have symptoms of gastroenteritis also. It doesn't mean that when you have symptoms of gastroenteritis, it's due to the gallstones. No? Iba yun. No? So once you recover from the gastroenteritis, andyan pa rin gallstones mo. Diba? So in the future, you might have some parang baka magkaroon ka ng symptoms, pero ang symptoms ng gallbladder stones will be abdominal pain doon sa right upper quadrant. Usually doon lang. No? Okay. So iba yung symptoms. No? So iba-iba. No? Okay. So yung mga pasyente nga mayroong incidental findings of gallstones, I have to, if they have abdominal pain, I have to make sure that it's not due to acid peptic disease, due to GERD, no? Kasi pag in-assume mo it's due to the gallbladder disease, operan siya, tinanggal yung gallbladder, no? Yung pala, yung symptoms niya are due to the acid peptic disease. Sayang lang, di ba? So andyan pa rin ang abdominal pain niya, no? Okay. So I really have to analyze it, no? Okay. Kung kailangan mo endoscopy, mag-endoscopy muna bago baka may makitang peptic ulcer, no? Baka that's the cause of the abdominal pain, no? Not the gallstones, no? Okay?
Yeah, there is a comment from Susan Tan. Doc Hosen, appreciate the free informative session. Thanks a lot. And from Baby, he said that Ursiflora is a good bacteria when you're having problems sa tiyan.
Okay, nice to have. Nice to have. Okay. Okay. Any more questions? Last call. We have a new attendees here. Marilyn, do you have any question, Marilyn? Meron kang tatanong, Marilyn?
Wala. Ano lang, Doc, 2 weeks ago, nagkaroon ng abdominal pain yung husband ko. Pero hindi siya kumain ng any medicine. Nagpa-check up kami sa doctor. And then sinabi ng doctor is might be appendicitis. Tapos nagpa-blood test, mataas yung kanyang albumin, 3 positive, ganyan. And then sabi niya, punta kami sa surgeon, and then pupunta kami sa surgeon, sinabi niya na tanggal na nga daw yung appendix, and then na lang daw magpalapa. But nagsi-second kami kung itutuloy o hindi. Pero hindi namin tinuloy because yung pain niya naka-concentrate doon sa may puson. And then may konting pain sa lower right quadrant, but mostly it's in the center lower quadrant. So nag-second thought ako, sabi ko sa husband ko, usap muna tayo kung itutuloy natin o hindi. And then hindi namin tinuloy. We go to another doctor, sa gastro na nga. And yun, mataas kasi yung sugar niya. And then may binigyan lang siya ng yung sinasabi niyo pang spasm, pang pain at saka antibiotic. And now nag-okay naman na siya pero we're going back to the doctor after a month kasi mataas na yung sugar niya, there's a lot of test pa. So I was only invited by a friend to listen to your talk today.
Yeah,
Parang
you're welcome. May natuto ka na sa akin.
Yes po. And truly no, kasi ako ganun din eh. Pagka nag-LBM ako, hindi rin ako usually umiinom ng mga anti ganyan. I just let it poops lang ng poops and then drink a lot of water para mapalitan yung lumabas na ano. Ganun lang. And okay lang naman kasi yung sabi nyo nga 'di ba, pagka nag-take ka ng medicine yung anti, magi-stop ka pero yung yung toxin hindi lumalabas, hindi kailangan palabasin yung toxin. Ganun lang yun sa akin.
Tama. Okay.
Lang po.
Okay. Okay. So, if there's one thing that I would like to impart to you, yun na. Huwag kayo isang kibot na meron kayong Imodium, no? Ganon.
Yes po,
Okay.
opo.
So, palabasin niyo muna, hintayin niyo muna, lumabas yung mga toxin, no? Okay, it will stop, no? Basta
Yes
inom na
po.
kayong tubig, then blunt diet, huwag kayo kain ng kain. Anyway, pag sumakit ang tiyan nyo, wala rin kayong ganang kumain.
Opo.
Okay. So, just wait. Kasi yan ang common practice ng tao because of the advertisement also sa internet, di ba? Sa Imodium, di ba? Okay. Okay.
Thank you.
So yung husband mo, so mali yung acute appendicitis, butit na lang hindi siya naoperahan.
Mahal-mahal pa naman magpalapa. Ang sabi kasi niya, baka daw kasi kinapa niya since meron husband ko na line na may mga cancer, baka daw may tumor sa stomach para daw makita na agad. So kung makita, meron, i-ooperahan. So lalo kaming kinabahan, kaya lalo ako nag-second thought kung dapat nga ba o hindi. Yun.
Kaya yung tinatawag na maximalist, lahat gagawin. Na? Okay. So, ang approach niya, kung ano yung sakit niya, doon mo na, wag isipin yung family history, mga ganun.
Yan nga po. Saka one thing kasi kung halimbawa, matanggal nga yung appendix niya, and then, pagtapos ng operation or ng lapa, there's still pain. So, hindi yun talaga yung cause ng stomach pain niya.
Yeah,
We need to know, yes po, di ba? We need to know, ano ba talaga? Bakit kailangan operahan? Yung sa akin, ang kaba ko lang, mamaya, appendicitis nga. Kung pumutok, parang nagkakaroon ako ng second thought. Pero, I thank God for guiding us, giving us the na hindi muna talaga, tawag muna na ibang doktor, pa-check mo na sa ibang doktor. Ano yung suggestion? Yun. So, yun naman po. Okay naman po na.
Okay. Good. Second opinion. But make sure you have a second opinion from a good doctor also.
Yes po. Opo.
Okay. 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 Sige. So, you're welcome to attend every Actually, we had a lecture on the right lower quadrant acute appendicitis already last 3 or 4 months ago. No? No? I can show you the link on the PEP talk on right lower quadrant abdominal pain. Tapos na kami doon na? Okay. So you observe lang naman kung you observe mo lang, huwag kang masyadong matakot na puputok. Basta you observe mo for 1 hour, 1 day, 2 days, no? Lalabas yung acute appendicitis na yan no? Okay. So, kasi kung minsan tinatakot kayo ng mga doktor na kailangan operahan na kagad, baka pumotok, di ba? Okay. So, hindi ganon, no? So, pwede pang 24 hours, no? Ganon. Kung minsan nawawala rin yung appendicitis, di ba? Kung minsan, no? Okay. So, last call, no more questions. Thank you for attending, Marlene.
I have a question.
Sure.
Thank you also, Doc.
Oo. Pag namaga ang appendix mo, let's say it's inflamed, is that visible through a CT scan or can that be seen?
Yeah, kung yung magang-maga, yung talagang distended, yung okay, makikita, no? Pero pag hindi nakita, hindi ibig sabihin wala rin, no? Okay, so you can have acute appendicitis na hindi magang-maga, na? Okay. Pero kung magang-maga, they will use it as a basis for suspecting acute appendicitis. No? Okay.
So that's visible pala. Okay.
Yeah. Ngayon, puro CT scan ang ginagawa nila. Na-CT scan ba yung Marlene, asawa mo?
The doctor suggested us to take the CT scan. But sabi niya, instead of CT scan, para daw diretso, maglapa na lang kami. Pero pero we did not. Hindi po kami nagpa-CT scan din because it's too expensive also eh. 'Di ba?
Okay.
Nag-suggest naman yung isang doctor na kakilala namin na mag-check muna sa full ultrasound ko yung husband ko, full abdomen, and wala naman nakita na okay naman lang siya, may nakita lang na stone, kidney stone yata yon, and then fatty liver siya, maybe it's because of the diabetes, and ano pa ba yung kanyang prostate gland niya ay lumalaki.
Okay, so marami na nakita kasi maraming test na ginawa. Okay, so yung acute appendicitis, the most reliable diagnostic basis will be yung dinidiin sa right lower, no? Pag persistent, na basta wala yung ibang sakit na UTI, walang symptoms of UTI, kung sa babae, walang dysmenorrhea, gano'n, na. So once na tanggal mo yon, na-eliminate mo yon, most likely acute appendicitis yon, no? Okay.
Pag di ba, pag hindi naman continuous yung pain doon sa lower right quadrant na yon, hindi
Usually hindi.
siya, di ba? Kaya
Yeah.
po nagdalawang isip ako kasi yung pain hindi siya matagal doon eh. Sandali lang eh.
Yeah.
Yun.
Okay. So usually persistent na tuloy-tuloy, kung minsan nag-i-increase. Pag nag-i-increase, no? Basta tanggalin mo lang yung mga possibility of kung sa babae, baka ectopic pregnancy, no? Yung mga iba, dysmenorrhea, yung iba, UTI. Pag walang symptoms of UTI, most likely acute appendicitis yon, no? Now, if you have to do, I don't usually do a lot of tests. I just rely on, babalikan ko lang yung pasyente, kakapain ko lang. Kapain na kapain, no? Okay, every hour, every 2 hours, every 4 hours, tuloy-tuloy lang, no? So sometimes kung sa telemedical, I ask the patient to observe diin, no? And then, sa telemedical kasi pwede ako mag-telemedical every hour, every 2 hours, no? Okay. I don't have to go to the hospital. The patient doesn't have to go to the hospital, di ba? So I have treated 2 or 3 patients ganon, na right lower quadrant, you observe lang, nawawala naman, no? Okay. So, but if you are doubtful, if you have to do diagnostic tests, ultrasound can be done, pero mahina ang ultrasound, na? CT scan is more reliable if you want to diagnose acute appendicitis. Pero ang makikita sa CT scan, dilated yung appendix, na? Yung tube, na? Okay, pero pag hindi siya dilated, it doesn't rule out acute appendicitis, no? Pwedeng may acute appendicitis pareho, basta masakit ang tiyan, no? Okay.
Yeah.
Okay, so yung approach na yun, para sigurado ilapa, nako, mali yun, mali ang approach na yun, no? So you have to start with your diagnosis kung ano, no? Okay. So may mga tinatawag na, you don't call that maximalist anymore. Baka ang gagawin sa iyo, lahat na ang gagawin sa iyo, no? Shotgun na.
Shotgun.
Okay. So, did we answer your concern, Maria Justa?
Yeah, because well, it happened to my brother, pero because we're old people, and when it happened, wala pa hong CT scan, walang ganon.
Okay.
He kept on, the pain that he was feeling was in the middle, nasa tiyan niya.
Okay.
And it would happen, then it would stop. This went on for months. And then one night, he came home early from work and said, oh wow, talagang masakit. And then, that was when he said, pati daw yung kanan, masakit. So, wala na. We brought him to the hospital, and true enough, he went under the knife. His appendix was huge. It was
Okay.
It was,
Sige. So ilang
Oo.
days yun bago siya na-operahan?
Ay, buwan ho.
Buwan.
Months before.
Months.
Months before he went under the knife because the
Ah.
pain was, wala na. The next morning, wala na. Pero it was really big.
Okay.
Tapos, feeling was, lagi siyang naiihi. Balisaw-saw.
Yeah, malisaw-saw.
Kasi naaita yung kanyang because of the inflammation.
So yeah,
Yun.
that's an illustration that anything can happen. Iba-iba yung course ng sakit ng tao. Importante yung monitoring, close monitoring and check-up. No?
Oo. Hindi kami naman kampante was saying wala na the next morning. Ayun.
Yeah,
So-
ang advantage ng telemedical ngayon, kasi pag check-up, sinasabi mo check-up, pupunta ka pa ng hospital. No? Di ba? Dati, pupunta ka ng hospital. Ang so inconvenient. So, pwede
Oo.
naman sa first check-up will be yung physical exam, face-to-face. After that, pwede nang telemedical. No? I-monitor na lang. No? Kahit na every 3 days, pwede. Gano'n. No? Okay.
So talagang at least meron CT scan.
You can reach out to your doctors through telemedical. You don't have to go to the hospital. No? Okay. So, okay. So with that, it's 3:20. So we call it a day.
Dok,
Yes.
pahabol.
Sige.
Is the albumin test fasting ba yun? Yung blood test?
Albumin, baka pwede
Albumin.
hindi. Baka hindi. Baka pwede hindi.
Okay, thank you.
Okay. Any more? Okay. If there are no more questions, let's call it a day. Next topic will be probably hepatitis.
Okay, thank you.
In common condition tayo muna, ha? Hepatitis. Okay lang?
Okay po.
Salamat.
Thank you, Doc.
Okay, bye-bye.
Thank you. Thank you. Thank you.
Bye-bye.
Thank you, Doc.
Bye-bye.
Bye-bye.
Bye.